Our next presenter, Ted Ball, is going to speak to the fourth and final strategic direction of our IHSP, and that's to increase the value of our health system for the people that we serve. Now, for those of you that know Ted or have interacted with Ted, he speaks his mind. He's very straightforward, tells the truth. So I'm looking forward to a very interesting conversation this afternoon. So Ted's a partner in Quantum Transformation Technologies, a consulting firm specializing in building the internal capacity of organizations to redesign and transform themselves using the systems thinking-based tools and processes developed by Quantum and its strategic partners, Quantum Innovations of Austin, Texas, and ClearPath of Seattle, Washington. In the past, Ted has worked as a speechwriter, policy advisor, chief of staff to Ontario Ministers of Health from all three political parties. He has operated as a transformation coach to CEOs of hospitals, CCACs, community services, and think tanks, as well as being a facilitator for high-performance teams developing strategy, creating knowledge products, shifting corporate culture, designing new governance processes, and reconfiguring whole service delivery systems. You may be familiar with his blog. For those of you in the healthcare system, if you're on Ted's blog, very insightful, lots of good information that comes, where he writes about everything from organizational transformation to leadership, governance, and health links. So please join me in welcoming Ted Ball to the stage.
The clicker? It's on the... Thanks so much, Michael. Michael introduced me there very kindly to say that I'm known sometimes as a truth teller, that I tell the truth. So I'm actually a pathological truth teller, which actually gets me in a fair amount of trouble some days. And I see my friend Steve Paikin has left, but Steve Paikin always has me on his show because he knows all he has to do is turn to me and say, "So Ted, what's going on?" And I'll pathologically scream out whatever the truth is, which some people find really annoying. Now, so I want to tell you this story. It was just before the last election, and the topic of Steve's program was, did the Liberals pass or fail on the healthcare file? And so we had the whole program devoted to the subject of, did the Liberals pass or fail on the healthcare file? And it was a great program, and everybody participated very, very well. And at some point, there was a commercial break, and the producer of the program came running out to announce that the Minister of Health herself was tweeting away after everybody would say something on camera. She would tweet something off to the universe, and everybody was following it. And then came towards the end of the program, and it's the last 60 seconds of the program. And Steve turns to me and he says, "So Ted, take it away. Did the Liberals pass or fail on the healthcare file?" And I went, "Oh, crap." So I looked into the camera and I said, "Well, Steve, on the education file, they actually got across the finish line, but on the healthcare file, not yet." And so all hell breaks loose, and then I understand that the minister stopped tweeting. And the minister has not yet arrived, but I'd like to say, if Steve asked me the question today, have the Liberals passed or failed on the healthcare file, my answer is they're passing, big time. And I'm saying that for two reasons. Number one, Deb Matthews has absolutely wrapped herself in patient-centered care. Anywhere you travel in this province, everybody is babbling patient-centered care, patient-centered care. She's the person who branded herself that way. She's the one who's inculcated that throughout the ministry and throughout the healthcare system. And for my money, this is the smartest strategic move that we can make in the healthcare system, which is a massive redesign focused on the patients. The second reason why I'm so excited about Deb Matthews and her contribution to really the evolution of healthcare in Ontario is I attended the May 15th Ways and Means big conference on the health links. And the minister was the final speaker there. And she came out and she said some extraordinarily liberating things. right? And we're talking about a low rules environment. And she says, I want healthcare providers to dream, to imagine, and to get it done, and I have your back, right? So go forth and innovate, I have your back. These two things, focus on the patient, patient-centered care, and the minister has your back, go forth and innovate, are the two things that we need to liberate this system and move forward. I've been asked to speak on the issue of value. Well, value. And actually, I've been noticing some folks back there were starting to nod off, so I'm going to make sure that you're not going to fall asleep. Others have not been asking enough questions, so I'm going to beat some questions out of you. So value generation is often an economics term. We talk about creating value, and they tend to be about assets, right? Not about services, but about assets. Value and valuable. What's valuable, right? What do people actually value? And one of the things about the humans is we're very complex, and therefore our attitudes about value is complex and instinctive. Also, the other thing about humans is we're profoundly emotional beings, right? The moment we have a thought, an electrical impulse leaves our brainstem and floods through this part of our brain, little almond-shaped part of our brain called the amygdala, filled with every mad, sad, glad, afraid, right? So we're profoundly emotional beings. So when you talk about healthcare and value, we're talking about people really having a deep-seated commitment to their healthcare system, maintaining their healthcare system for themselves and for their families. And Canadians in Ontario, and in particular the people of Southwest LHIN, really do value the healthcare system. I don't know if you looked at the data that's in your kits about the number of people in your community that value this healthcare system, that high satisfaction rates. If anything, you guys are in trouble because I'm going to have some scary things to say in a few minutes, and I think you've got a population that is extraordinarily happy with the services that you provide, and maintaining that is going to be, maintaining that level of support and happiness is going to be a challenge. So we have a deep emotional attachment to maintaining our healthcare system. So that's one of the key things about your strategic issue number 4, which is the value. Let's take a look at some facts. Despite our big emotional commitment, we've got Canada's healthcare system on a per capita basis is the 4th highest among 17 countries, but we rank 10th in overall performance. I think Saad Rafi started today saying, you know, we used to talk about how wonderful the healthcare system is in Ontario. Well, not so. We're not so great. And all of the more recent studies are telling us that we're, last place on patient-centeredness. We're all wandering around talking about patient-centered, patient-centered, patient-centered. In 17 countries, we rank last place. 1 in every 3 patients who come to a hospital in this country are going to be harmed. 25,000 people on an annual basis will get killed in a hospital by accident. That's called preventable deaths. That's the equivalent of 2 jumbo jets crashing weekly for about a year. Now, do you think if jumbo jets were crashing weekly, we wouldn't ask, is there something the matter with the airline industry? Right? So there are some real concerns about quality and cost and safety in our healthcare system. We've got waste at extraordinary levels. I know I tend to annoy a lot of hospital CEOs in particular, when I talk about the 30% waste in our healthcare system. A fellow by the name of Paul O'Neill Sr., I don't know if you recognize that name. Paul O'Neill Sr. was the Secretary of the U.S. Treasury during the first George W. Bush administration. He got in trouble with George because he said that the president had fibbed about weapons of mass destruction, got in big trouble, had to resign, took off, went to his hometown of Pittsburgh, where they did the Pittsburgh healthcare miracle. Okay? Pittsburgh Healthcare Miracle was they saved 40 to 50% of the costs in something like 40 hospitals in the Pittsburgh area. When Paul O'Neill Sr. came to Ontario, specifically he came to North York General Hospital, where Bonnie Adamson, now at London Health Science Centre, she was there, and he pats me on the head going, "You're so Canadian, Ted, 30%. Hey? It's 40 to 50% waste in the healthcare system." Now, I'm still a Canadian, so I'm going to say 30%. But 30% of 47 billion is an awful lot of money. Okay? And so we have got waste as a major problem. Let me give you the example there. When Paul O'Neill came to visit us at North York General Hospital, you'll see it says there 169 steps to 10. So at North York General Hospital, if you came and arrived at the emergency department, it was 169 steps that you took to get from the emergency department to a bed. So we did a little Kaizen group, collective intelligence with frontline workers and with patients, to say we're going to show you each of these 169 steps, and we're going to ask you a simple question. And the simple question is, would you pay for this out of your own pocket? Would you reach into your purse and give us money for this step? And if you wouldn't, we're going to get rid of the step. So we pulled out each of the 169 steps, and 10 of them survived. So we went from 169 steps to 10 steps, shaved about 5 hours off the wait time, saved about $700,000 a year, and made patients really, really happy because, so when we talk about patient-centered care, that's the other wonderful thing, I'll talk about patient-centered care, but every time we do patient-centered care, it ends up being cheaper, usually by about 30%. So patient-centered care is not only the smart thing to do strategically, but it's also economically the right thing to do in terms of saving money. And so patient-centered care, as I said, our minister has said two things. Focus on the patient, design around patient-centered care, and you're liberated to move forth and be innovative. Those two combination things in that story should set us all, into a massive redesign of our system focused on the patient. So Deb Matthews has really made patient-centered care her focus and her branding. It's become the buzzword in healthcare policy and right across the province. But what does it mean? What will we do differently if we are patient-centered? So I've been in the transformation business for about 25 years. I'm real glad that there's now a transformation secretariat and everybody's talking transformation, because it was very lonely back out there in the olden days. In the early 90s, everybody wanted to do, let's do re-engineering. Well, re-engineering failed 70% of the time, normally resulted in increases in mortality and morbidity that range from 200 to 400%, right? Lean thinking, marginal improvements, but still 70% failure rates. In fact, all major, that's one of the things about health links, is that we should remind ourselves that every single major change initiative ever undertaken has resulted in about 70% failure rates. Nobody ever seems to be curious about, so what did those 30% do? Because there's where the gold mine is what can we learn from success in the healthcare system? What I can tell you is that there is real knowledge and wisdom on the front lines of the healthcare system. These are where the answers are. The answers to our most complex issues are in the hearts and minds of healthcare providers in conjunction with patients and their families. People are smart. Now, there's the stuff you know and the stuff you didn't even know you knew, and I'm going to describe that here. The stuff in the center is, here's all the stuff you know. Now, in healthcare, we tend to hang around that center dot going, ooh, I know this stuff. I know this stuff. But, how many of us, if we were really open to learning, how many of us will be able to talk about the stuff you know don't know? Gee, I don't know what you're talking about when you talk about the patient experience design. What is you talking about? Systems thinking? What are you talking about? Well, the moment you can say, I don't understand what experience-based design means, I don't understand what you're talking about on systems thinking, you've just opened a door, which is you are now permitted to learn it. Because until the day you say, I didn't know, no, stuff you know you don't know, right? You can name it. You can say, I don't know that. Well, now we can help you out. Right? Now there's this other category there, which is the stuff you didn't even know. Right? And we often do this. We do emotional intelligence. We give people reports on their emotional intelligence, and they're looking at it and they're going, wow, I didn't even know this. So you got to be really curious to be able to say, there's stuff I know I don't know, and here's what they are. And there's stuff that I didn't even know, and I really want to find out. But there's this other category up there, which is stuff you know, but you don't know you know. In other words, you're quite brilliant, and you know stuff. It's just you don't know you know. So we need to give you some tools to pull out some of the incredible knowledge that are in your brains, and it's usually in your collective brains. So the first time I discovered this, I was with a CEO, and he was on his 6th or 7th or 8th balanced scorecard, and he thought I was like this expert in balanced scorecarding, and he turns to me and he says, well, this always works out this way. And I said, well, I didn't know that. And he's going, well, no, you would know that. And I go, I don't know that. And he didn't know he knew. And I'm telling you, you don't know what you know, and you know a lot. So we got to get into some areas where you're feeling more comfortable not knowing and discovering what you do know and getting innovative and focusing on the patient. And we're calling that these days disruptive innovation. Disruptive innovation, what is it? So it changes that cause fundamental paradigm shifts in the way we think and behave in complex adaptive systems. It's transformational. The internet, personal computers were examples of disruptive innovation. The moment they were introduced, the whole world changed. We didn't go back to the old way. It fundamentally changed. When we went and took those 169 reasons for rules and things for the North York General Hospital, when we held them up to the light to say, why did we get them, right? Someone would say, oh, I know. Remember the time we got that memo from the deputy minister who was all upset about blah, blah, blah incident? That's when we invented steps 62, 63, and 64. Then remember the day the board met and they were really upset about that incident that took place on Ward 3? That's when we end up with 59, 57, and 56, right? And so we start, and these are becoming ass-covering bureaucratic steps to try and protect us that add no value to the patient. So we got to clean the slate and look at disruptive innovations that allow us to start over. Among disruptive innovations in healthcare is the whole field of experience design methodologies. And you folks have learned some techniques in experience design methodologies. As you shift your system, and this will happen incrementally over the next 2 to 3 years, you will move from the first curve healthcare delivery system to the second curve healthcare delivery system. You'll move from acute care as the hub of the system to primary care as the hub of the system. A system that is fragmented to a system that is seamless, to a system that's right now focused on sickness and episodic individual care, to a system where it's health outcomes focused and it's got a systematic population-based approach. We will move from a provider-driven system, structures, and processes, and people are really innocent about that. They don't really realize that it's all provider-driven. It's all designed for the convenience of providers. It is not patient-friendly. It's not patient-centered. And so that transformation will take place from provider-driven system, structures, and processes to patient and client-driven system, structures, and processes. Now, I've looked, as I said, I've done about 100 strategy maps and scorecards. And when I looked at your integrated health system plan for Southwest LHIN, I'm really, really excited. The deputy said it. He says, bang on the money in terms of where the province is going. And I'm saying it's bang on the money on every indicator you can think of. On your mark, get set, go. Go forth and implement your integrated health service plan. And I'm going to tell you why you should be in a real hurry in a minute. In addition to it has the following drivers. connecting and empowering people. Let me say just something about the empowering of people, because I was at a meeting, the meeting was with Deb Matthews' office not long ago. I work as a pro bono consultant with a lot of different groups, one of which is the Canadian Patients Association of Canada. And so we said to the minister's office, and it's actually from change management. Change management says it's the 30-30-30-10 rule. When we're on the precipice of major change, about 30% are on board, ready to roll. 30% are on the fence, not too sure. 30% are absolutely opposed and are going to fight you every way. 10% are clinically brain dead and don't give a crap. And we said, it's the same thing with patients. 30% actually want to be the boss. Okay? When we talk about patient engagement, patient partnerships, we're talking about 51%, you got 49%. I'm the boss. Okay? 30% are going to say, no. I want 49%. You're the boss. You're a nurse. You've learned stuff. You're a doctor. You went to school. You take charge. I don't want to be in charge. But I want to be a full participant as a partner at 49%. And 30% of us are saying, not at all. We want like 1% or nothing, right? We really don't want it. So in terms of people empowerment, we've got to get a system that's ready for people who want to be the boss, people who want to take instructions, and we have to be flexible about that. Your other drivers were quality and value, which is bang on the money, and technology that gets you to connect and communicate. Your three goals, I mean, this is great. Everything about your integrated health service plan really deserves a great big hug. Imagine here you've got health and wellness as one of your goals. Holy crap, this is a creature of the Ministry of Health wants health. That's never happened before. It's the Ministry of Sickness. It's the Ministry of Doctors. It's the Ministry of Hospitals. It has no interest at all in health until just recently they took over the Ministry of Well-Being, or whatever it's called, health promotion, got brought into the Ministry of Health. And now we're interested in health. And it's your number one goal. Smart. People's experience, okay? And smart, this is great. And sustainability of the system. I'm going to address the sustainability in a moment, and we're in trouble. 4 strategic directions: primary care access, better coordination at the handoff points, evidence-based decisions, increasing value for citizens. And as I said, having looked at 100 different scorecards, your logic models, your planning process, as I read that, and I don't know how many people here were deeply involved in it, but I can see thousands of hours were invested in the development of your integrated health service plan. And I say, on your mark, get set, go. You need to go full blast commitment with coordinated efforts in each silo across the delivery system, because we're going to get hit momentarily with one hell of a tsunami. And there's your tsunami. 150 meters into the air, taken from a cell phone off a little island off the coast of Japan. A nanosecond later, those houses are gone. The person holding the cell phone is gone. Everything is gone. We have a tsunami that's going to hit the province of Ontario with a vengeance. That tsunami contains a $300 billion debt. $300 billion. Now, if you folks here would just lighten up and be prepared to pay a lot more in taxes, and if we would just, get rid of our attachment to certain public services, what's the deal with education anyway? Those kids just get snot-nosed and uppity. Give them an education, right? We got to get rid of a lot of these costs. So if we were to cut waste, cut services, pay a lot more in taxes, and we could put together $1 billion a year to pay down our debt, why, that debt would be paid off in just 300 years. Now, it could be that in the next 300 years, Ontarians think that they might want to build a bridge or put in a sewer, but we know better. They can't afford it because we've borrowed all the money. And so they're in debt. we have a structural deficit. And now, you said I was a speechwriter for politicians from all three political parties. I was also chief of staff to the Minister of Finance in the province of Ontario when we were visited upon by these nice people from New York City wearing $10,000 suits. I did $10,000 suits, wow. From a place called Moody's Investors Service. Just a friendly little checkup on our structural deficit, right? And so when they discovered that indeed, cough, Mr. Ball, oh, you have a structural deficit. And so they downgrade you one little point. One little point, what could it matter? Well, a point costs your population $1 billion. So that's $1 billion in additional taxes that everybody has to pay just to pay the interest on the money we've already borrowed. It's not that you're getting anything for $1 billion more. That's just a bad boy. Today we're paying $10 billion a year in interest payments on the money we've already borrowed. $10 billion a year, that's more money than we spend on education and training of all kinds in the province of Ontario. And we've got really cheap interest rates right now. Wait till there's a little surge in the interest rates. See what happens to our population. Wait till you see what happens when Moody's Investors Service comes and visits our treasurer to say, I'm here to check your structural deficit. We're in deep doo-doo. So transformation, and we throw this word around quite a bit. Transformation. So what does it mean? Well, going from a caterpillar into a butterfly is a transformation. That's a lot of change in the DNA. You ready for that? You're going through a transformation. You're not going to be the same. All the assumptions you're holding now are rooted in a past that is no longer going to exist. We're off to a new place. You're all going to become butterflies. It's not going to be the same. And are you ready for this? Is everybody ready for this? We're bantering it about. We're transforming. Oh, are we? It's about deep change. Transformation is a process, caterpillar to butterfly. So are we really ready for a transformation? And the other thing is, it's the baby boomers that are going to drive this, right? If you see me limping a little bit, I need a new hip. I just turned 65. And apparently 65-year-olds all line up and get a new hip. It's the craze, right? I thought we were going to get free drugs. Doesn't turn out not. But we run this society. We're in charge. When we wanted to go to school, the whole society turned around, they built a network of grade schools. When it was time for us to go to high school, network of high schools. When we went to university, they built them right across the province. When we started having children, we mushroomed hospitals right across for birthing of babies. Then we started skiing and breaking our legs, so we got taken care of that. And we worked in our first heart attacks, right? Now, not so much. We want palliative care, home care, chronic care, home support. We got a system that was built for us when we were 21. And we're 65. And then there's you kids, but you don't count because we have all the votes. And so the system, I know it's disappointing, but the system will change to meet the vast majority of the population. The vast majority of the population wants home-based palliative care, home support, Meals on Wheels, and supports of all kinds. Our acute care sector is going to face a different kind of future. So Deb Matthews is shifting the healthcare service delivery system at the macro level. But can you outrun the tsunami at the local level? Because that tsunami is coming down, and it's going to arrive the day that there is a majority government. No one's going to touch this file and the realities of economic tsunamis during a minority government situation. But you don't have to wait, right? You're not waiting for an election. You've got an integrated health service plan, and strategic direction number 4 says, implement cross-sectoral system redesign, improvements in quality, equitable access, and wait times, greater system efficiencies to be pulled out of the hospitals, the long-term care homes, and community-based services. Now, if you did all that, the outcome of that would be improved patient experience, and as a result of that, it'd become more efficient, maybe as much as 30%. So what is this patient experience? Now, you folks have got a version of patient experience that came from the UK. I work with a guy who was the head of Disney's Imagineering Corporation. He's the guy who invented all the methodologies whereby that would create the guest experience at a theme park, a Disney theme park. How many people here have been to a Disney theme park? So arts methodology was what was used to design your experience. Now, people might be curious to know what would be the most exciting job, sought-after job, the job that gets the most training at the Disney theme parks. Anybody got any ideas? What it would be? Yeah? The Mickey character? No, it's not. It's a guy called the Sweeper, and it's a guy wearing overalls, green overalls, and he carries a broom, and he goes around picking up pieces of paper and dust, and they're extensively trained in human anxiety and body language. So if you're at a Disney theme park and you're stressed out, the Sweeper is going to be on you in a nanosecond, taking a look at, you have to go, what's your problem? You've lost your children, you're looking for the toilet, blah, 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 but they'll know right away that you're anxious, right? And so the design, now, Art finally has spent the last 15 years designing the patient experience, and a lot of his methodology has been morphed around the planet, including into the United Kingdom, and you folks have received some training from people who took Art's methodology and went in a few other different directions. I don't understand all their different directions, but I think you have tools that you have learned to redesign the patient experience, which includes patient needs, impressions, physical. I'm just pressing buttons here because I didn't know that this does this. Isn't that something? Wow. So that's the storyboard, and you do a similar version. But we've got to move from the world of strategic planning to the world of strategy execution. We're real good at doing a strategic plan. Okay? So there's a new minister, let's all do a strategic plan. Oh, there's a LHIN, let's do a strategic plan. Oh, there's a new CEO, let's do a strategic plan. We never seem to get around to executing. We're always developing strategic plans, we're never getting into execution. Now we have to focus on execution and making stuff happen. The Balanced Scorecard Collaborative says, top one there, 10% of all organizations don't even execute their strategy, right? That's no, 10% succeed. That's a 90% failure rate. So think of all the number of times you folks have participated in strategic planning of one kind or another. Only 10%. Think back on them. Think of your last year's strategic plan. Think of the strategic plan 2 years ago, 3 years ago. Well, the research data, and this is backed up by Henry Mintzberg as well, tells us that on average, only 10% of plans are ever executed anyway. Now, what blocks them? Well, take a look at this. The vision barrier. Only 5% of the workforce understands the strategy. So on your mark, get set, go, you're off to do the integrated health service mambo, but if you don't educate the front line, there ain't nothing going to happen. This thing's dead in the tracks. Only 25 people barrier, only 25% of managers have incentives linked to the strategy. Management barrier. 86% of executive teams spend less than an hour per month discussing strategy. And the final killer, the resource barrier, which is 60% of organizations that babble speak about this is the strategic direction we're going in, don't actually fund the strategic direction. Until there's alignment between the finances to where your goals are, ain't nothing going to happen. So we've got to get real serious about outrunning that tsunami. On your mark, get set, go. What were the 30% doing that were successful? How do I address the barriers to strategy execution? How do we get out of the business of strategy development and into the business of strategy execution? We also have to, the people over here know that I don't have a watch and that am I okay on time? I'm still good? We have to transform barriers and aligning people. So our challenge is how to overcome these various barriers. How do we mobilize and align our people? How do we get people onto the same page, all pulling together? So this is, look at this. 500 people from your organization, from all your many organizations, are hovering around an integrated health service plan that I'm saying on your mark, get, set, go, fast as you possibly can, outrun that tsunami, because it's coming, and the more you get done in a rational kind of way, the more you will retain. The other thing I noticed about London, and not just London, the Southwest LHIN, is that somehow or other the people of Ontario have been kind of treating you nicely on the money side, right? We must have really liked you or something, or maybe you had friends in high places, but you've done better than most people on your budgets and on the number of doctors you have and on the number of nurses you have. You are very, very gifted. And so in a world of scarcity, there's going to be some people looking in this direction going, how the heck did you guys get so much, right? And so we're going to need everybody pulling on the same page, getting on the same page, pulling together. How do we create the synergy and the alignment? Now, if we all leave here today, take a look at that non-alignment box there. That's where every one of your health service providers leaves here today and marches off in a different direction, right? And that produces chaos. Or do we leave here today completely aligned, knowing our goals, our strategic directions, our integrated health service plan, the drivers, and how we're going to pull this off and when we're going to pull it off and how we're moving and how HealthLinks fits into that and how we've got to do it all at the same time. The thing about complex adaptive systems is that they are profoundly human. That big scary wave is going to scare the crap out of people, and I'm particularly worried about, because those of us who are around in the early 90s saw when our beloved Premier Mike Harris came on, who decided that nurses were like hula hoops, they'd gone out of style, and we took 5,000 nurses by the scruff of their neck and dashed them into the pavement, right? 5,000 nurses lost their jobs. So we're looking at a set of organizations that's going to be looking at that tsunami and hearing some scary stuff out of politicians, and they're going to be worried about job security. They're going to be worried about making their mortgage payments. And so emotional intelligence, treating people with respect, being adult, really calling upon the wisdom of our boards. And I saw a good number of hands go up here of representatives from boards. Boards are like our parents. We need some guidance through this thing. There's going to be some major stuff to do. And boards cannot be sitting there representing their little silos. Boards have to become grown up. Boards have to start to represent the people that you're supposed to represent, which is not the silo that you're from, but the people who own the silo. And the people who own the silo are the people of Southwest LHIN and the people of Ontario and the taxpayers. And that's who you're there to represent. And you need to coach your people through to get them through this very interesting set of things. Now, I put this one up here because, and I usually have to draw it out, but I can't draw it out today. It's on a slide. But look at the red S. So you can't see an S. Look at the red part. The red part is called an S-curve. And economists use the S-curve as a product life cycle. So that S-curve is a product life cycle. And the product life cycle says every product, every organization has a beginning. Starts off over here. And it begins to develop, and when it reaches its very top, it then atrophies and goes into death. Smart people, smart organizations know we're not going to die. We need to reinvent ourselves. Let's have an integrated health service plan. And so you start the new green one that's starting right there, integrated health service plan, coming up there, and you're going to reinvent yourselves over the next 3 years. Now, in the meantime, you're going to have 1 foot firmly planted on the red part of that line and 1 foot firmly planted on the green part of that line. And after a while, the tension begins to build, and the pain you feel in your crotch is bifurcation. And bifurcation is this point in time where the hash marks are, right? The point of bifurcation is when people are trapped between the old world and the new world that hasn't arrived yet. They're in a state of bifurcation. And change management scholars will tell us that we're going to go through the following reactions. First, denial. Denial. It's not just another river in Egypt, right? We're not going there. That's not true. You're wrong. We don't have to change. I've been doing this for 400 years and we don't have to change. We will then hit a period of resistance where, you think we're going to change? I'm calling my union, okay? I'm going to call in whatever my union is and we're going to put an end to this. Or after, and basically Ontario's been in denial and resistance for quite some time. Right now, I sense we're in the point of exploration. Exploration is when we stop and we say, oh, okay, wait a minute. We really can't carry on this way anymore. We really do have to change. And so we're now open to looking at, so what is this? We'll hold our nose, goddamn LHIN will, what the hell? They've got an integrated health service plan. Let's give it a try. Okay, let's get into exploration. And the final energy hit you need is commitment to get you up and out of bifurcation and onto the other side and into a new world. Now, I've spelt out the words D-R-E-C, DREC. Does anybody know what DREC is? There's a few people giggling here. DREC in Yiddish is shit. And you're going through shit. 90, on my desk is a Fast Company magazine, and the headline screams, change or die. And I keep it on my desk. It's from May 2008. I keep it on my desk to ask myself, why did I go into the change management business? I can't believe I did that because according to the research evidence, 90% of us would rather die than change. Okay, this comes from research from primary care physicians who tell us that when they sit down with a client and they say, Mr. Ball, if you don't change blah, 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 blah behavior, you're going to die. And 90% of the time, Mr. Ball will say, I choose death. Okay, so understand, we're not all excited about change. We're not. This is not going to be, I guess I'm saying there's no choices. We have to reinvent. We have to become butterflies. We have to leave our, it's not a cocoon. We have to leave whatever the state is when you're a caterpillar. We have to leave that stage, okay? Terrifying. Holy crap, we got to leave that. We got to become butterflies are pretty, right? They're different, and we don't really know what it's going to look like, do we? So that's scary, the unknown. So we got to go through DREC, and we've got to take everybody through it. And this is the leadership of your system. And the people who aren't in this room are going to be quite scared and quite worried about what does this change mean and are we really transforming and all the rest of it. What we've learned is that 70% of the time, major change fails. Only 30% of the time does it work, and you really got to figure out what are the reasons that it works. The other thing is Demings Wisdom, which is, it was actually called the 80-20 rule from Deming, and then he was on his deathbed, died at about age 84. He's on his deathbed and he's saying, no, 80-20 is wrong. It's 93-7. And so what was this 93-7? Deming said 93% of the time that he had ever looked at an organization in trouble, that 93% of the time it was due to its design, the design of its systems, structures, and processes. 7% of the time it was a people-related problem, but half the time it was a people-related problem, it was just a lack of skills. So we're down to 3.5% of the time it's because they're assholes. Right? Which really says it's not about bad people. We're not struggling because our doctors don't get along with us, our nurses are lazy, our CEOs make too much money, our board members are weak and don't know stuff. None of those things are real. We don't have a people problem. We have a design problem, and we need to fundamentally redesign systems, structures, and processes. This is not Demings. This is another guy whose name I can't remember, which is the definition of wisdom, and I put it up there. Wisdom equals knowledge plus experience plus reflection minus ego, which I love. So 93% of the time, it's design issues. We need to fundamentally redesign the system. What's that going to take in terms of the people in this room? People in this room are going to have to learn to become adaptive leaders. What is an adaptive leader? You artfully guide people through a balance of disorientation and new learning. Leaders need to hold the group at an optimal state of tension and disequilibrium that stimulates a quest for learning without jarring people so much that they simply aren't able to learn. And so we have to manage the disruptive innovation and all of the things that are going to have to happen to make a better system. And I'm noticing the body language, maybe my metaphors have scared you. The tsunami may have scared you. I really think we can build a better system. That the system we've got, while it was wonderful to celebrate it for so many years, celebrations are over. We need a new system. People want a new system. And I just want to check on the time. I have a full 7 minutes left. So then I'm going to do a test. I want you to think about, this is a guy I used to work with, Peter Kossenbaum, philosopher. Became a leadership coach to Fortune 500 gurus, Fortune 500 leaders. He was the guru. And the Kossenbaum Leadership Diamond had the following attributes: ethics, courage at the bottom, reality at the side, vision over there. And he talked about polarity, or the tension between ethics and courage, the tension between reality and vision. What I'd like you to do is I'm going to give you a test here, which is we're going to score the Integrated Health Service Plan on using the Kossenbaum Leadership Diamond. So let me describe what he meant. Ethics, Peter talked about the love of people. First time I heard him say that, I said, what do Fortune 500 CEOs say when you say love of people? He goes, well, Ted, the really smart ones who really want to make money go, perfect, right? Because loving people is really profitable. It is. So ethics, the love of people. He defined reality as understanding our current circumstances with absolutely no illusions. Okay? We tend to wear rose-colored glasses and pretend things. Right? Drop that. What is the clear truth? And then vision, he described as not what Peter Senge talks about, which is a picture of the future you seek to create, but he talked about vision as your track record at willing the future into existence. So you've had 2 other integrated health service plans. To what extent did they come true? Right? What is our track record at willing the future into existence? And courage is our preparedness to take action. Because in real bureaucracies, even your plans have plans. But nobody ever gets into action, right? So I'm going to do a scale of 1 to 10. Each of you are going to mark this. And I'm going to say, on a scale of 1 to 10, on the issue of ethics, which is the love of people, to what extent does our integrated health service plan in this LHIN really reflect a deep love of people and commitment to our population? Scale of 1 to 10, write it down. There's a trick to this. So write down your number, scale of 1 to 10, ethics. On a scale of 1 to 10, let's mark it on reality, which is understanding our current circumstances with absolutely no illusions. So to what extent does our integrated health service plan absolutely respond to the truth of our current circumstances? Scale of 1 to 10. Vision. To what extent do you collectively have a track record that says in our Integrated Health Service Plan 1 and our Integrated Health Service Plan 2, we knocked it out of the ballpark, we got our vision, and now we're on Plan 3. So scale of 1 to 10, how are you at vision? Finally, courage, your preparedness to take action. What is your number, scale of 1 to 10, on our Integrated Health Service Plan in terms of its action orientation and our ability to take action? Now, what Kassenbaum says, you'll look at each of your numbers, Kassenbaum says your greatest point of leverage is your lowest number. Whatever is your lowest number, if you focus there, you'll get a bigger bang for the buck. So how many people had courage as your lowest number? Okay? How many people had reality as your lowest number? Okay? How many people had vision as your lowest number? Okay? How many people had ethics as your lowest number? Does anybody want to declare a winner here? So you're all winners, because you all did that for yourselves. But I think it's an interesting concept that your greatest point of leverage is your smallest number. And I've just been given the 2-minute warning, so I think I will. Take some questions if you wish. Oh, I can take a question. Does anybody have a question, or does anybody want to give a soliloquy that lasts 2 minutes? Questions, soliloquies, statements, rebuttals.
Over here, Ted.
Oh, questions over here.
Thank you for your talk. My question is, we heard this morning from 2 patients who spoke about some of the really good things that are in our healthcare system at the present time. And when I read the book Great by Choice, the sustainable organizations were the ones that had the wisdom to know what to take with them into the future and what to change. Can you comment on what you see is that balance in our healthcare system? Because change for the sake of change, when you don't take the good with you, I don't think is wise change. So can you comment on that discernment piece?
Well, I'll try, but it's a good question, but an impossible question, because I can't name all the things, but I buy the sentiment, which is, as a recent customer, I've been trying out, I just had heart failure, so I got to try that out, and then I had diverticulitis, and now I've got this hip. I understand we can get free lobotomies, so I'm lining up for that one. But there is some, as I get to experience the healthcare system, it is extraordinarily wonderful, and so are the people in it. And so absolutely, I think the biggest thing that we have to bring forward is the spirit of our frontline worker, and to really celebrate that and to make it an integral part of redesign and an integral part of making the future work. So I think it's about mining the best of what we've got, which is our people and their knowledge and their understanding and their compassion. Okay, then I'm done.